Hello everyone, and welcome to week 4, the second week of examining gender and gender minorities. This week, we will continue to discuss the biopsychosocial needs of gender minorities with a focus on transgender folks. The word transgender, often shortened to trans, is an umbrella term for people whose gender identity is different from the sex assigned at birth. An incredibly diverse population that has become more visible in recent years thanks to actors such as Laverne Cox and shows such as Pose, which had the highest number of transgender actors on any show in history. Transgender people still face an incredible amount of discrimination, stigma, systemic inequality, such as lack of legal protection, higher rates of poverty, lack of health care coverage, and difficulty getting identity documents. In addition to this, a study by the Human Rights Campaign showed that a majority, 54%, of trans people have experienced some form of intimate partner violence. 47% have been sexually assaulted, and 1 in 10 have been physically assaulted. As we have seen in the news, this violence can often be deadly. Understanding the risks undertaken by trans people on a daily basis is a key component in your social work practice, whether you are a clinical practitioner or a policymaker. The learning outcomes for this week are: compare and contrast various stage theories and models of transgender identity development presented in scholarly articles, describe various life issues that transgender individuals experience that may lead them to seek out services or assistance, distinguish between the various medical and non-medical transitioning options available for transgender individuals, specifying the various intents, risks, benefits, and reversibility or irreversibility of the various options as presented in scholarly literature. Apply knowledge about transgender psychology through practice case vignettes to direct assessment and treatment goal planning. Your work for this week includes 1 discussion board and 1 reflective journal, where you will play a therapist writing a letter supporting a client who wants to start hormone replacement therapy, often referred to as HRT. You are provided with several examples of these letters, but do not just use these as templates. Really give the issue some thought and write your letter as you would want it to be for a client. Please continue to work with and communicate with your small groups for your presentation that is due in week 7. And if you have any questions or issues, please reach out to your faculty.